lecture. I'm Sharon Manny. Thank you for joining us to the Survivorship Wellness Lecture Series. Next slide, Alyssa. I think you're handling the slide.
Oh,
okay. This is a lecture series. The Wellness Lecture Series is part of the Cancer Survivorship Center here at the Cancer Institute of New Jersey. And our goal is to identify and monitor unmet needs and disparities in our state and improve outcomes for cancer survivors in New Jersey. And develop some survivorship care standards and practices for our cancer survivors in our state, and to foster some good outcomes across the Robert Wood Johnson Barnabas health system, of which we are now a key part in the oncology service line. Next slide. I'm really happy to introduce Alyssa Bark, who'll be talking today, OTR, and she'll be talking about physical and occupational therapy for lymphedema. Next slide. We have a couple lectures left in our series for the end of this year. One will be on financial navigation and cancer survivors, an interesting and important area for people who are hit with bills after cancer treatment has ended. And then a lecture on oncofertility, which is an interesting area for people who are childbearing age in terms of preserving their ability to have children after cancer treatment. Next slide. We have a questionnaire we'll send you at the end, and we'll be sending it to those of you who are on this call other than me and the speaker afterwards. And the next slide is on our pamphlets. We'll also be referring you to our website, where we store all the talks in our series and some really great information for cancer survivorship. Next slide. I think our last is the pamphlet is in English and Spanish, so you'll be able to get a pamphlet as well in the mailing after the talk today. Next slide, sorry, Alyssa. And for any questions, just reach out to Jacinta afterwards. Next slide. So it's my pleasure to introduce Alyssa Bark, who will be speaking about a very important and relatively common treatment side effect, lymphedema. Thank you, Alyssa.
thank you. Thank you everyone for coming today. I just want to start off by saying this is just like some brief education so you feel more aware. I don't want to scare anybody. Just because we're talking about it doesn't mean you have it. And it's also not as scary as it sounds, and it can be managed and treated. But I am an occupational therapist here at Robert Wood Johnson, New Brunswick. And I'm also certified in lymphedema therapy. So that's a very specific type of treatment for people who have lymphedema. I also see some people just for preventative measures and education. So hopefully this is a good insight into that. So we'll start off with what is lymphedema. So it is a protein-rich swelling, as opposed to other types of swelling that's just fluid. This is full of protein. And it occurs after an injury to the lymphatic system. So it normally presents as a swollen limb, but the swelling is different than other swelling. So the lymphatic system, which consists of lymph vessels and lymph nodes, is present throughout the body. It filters and cleans fluid as it travels throughout the body and back to the heart. Lymph fluid consists of water, protein cell debris, and white blood cells. So sometimes there is an injury or a trauma to the lymphatic system. When this happens, the body cannot handle the amount of fluid being filtered throughout the body, and there can be a buildup of fluid on the affected side. You can see in the picture here, different stages of lymphedema. Don't worry if you are not at stage 4 right now, you really won't get there, especially if you're listening to these preventative measures. So the most common cause of lymphedema in the United States is cancer treatment, which is why you're all here. So it's not actually the cancer that causes it, it's the treatment. So radiation, surgery, removal of the lymph nodes. Frequently, there's at least a sentinel lymph node dissection for staging of the cancer, so at least one lymph node removed to assess the spread of the cancer to the lymph nodes. And any type of injury or impact to the lymphatic system can result in lymphedema or protein-rich swelling. So, for example, very common, Oftentimes you'll have lymph nodes removed from the armpit area after a breast cancer lumpectomy, or the lymph nodes can be damaged due to radiation to the area, even if you didn't have any removed. So now the body can no longer transport all of the fluid from the arm or the chest through the armpit, through the lymphatic system, and back to the heart. So this can result in swelling of the arm.
5:30 for John is here.
Sorry
5:30
about
for John is here.
I'm at work, so that was there. Okay, so here is some anatomy of the lymphatic system. You can see lymph nodes and lymph vessels are throughout your whole entire body. So you typically will only have this swelling or edema in the affected side, but you can see all these green dots and lines are the lymphatic system. The lymph fluid, it drains in the body in separated areas called root areas or territories. And that in the second picture, those are the black lines. So typically, let's say if you had a breast cancer or lymph nodes removed from your armpit, you'll only see the swelling between those black lines. So maybe in the breast and the arm and the hand. There are connections or pathways between the areas that allow for the redirection of fluid. So it can be drained to non-impacted area of lymph nodes. So that's what the therapy would help with. So we can cross that barrier and get the fluid moving to more healthy areas. So signs and symptoms to look out for lymphedema, most obviously is swelling. There can also be skin changes, so redness, firmness, papillomas. Now papillomas are those tiny red dots that you see in that picture, kind of hard pimply things. And the hardening and the papillomas, that comes more in the later stages. In the beginning, you'll just see some swelling. And if you do have lymphedema, you're at an increased risk of infection. So an infection could also be a sign. Here are the stages of lymphedema. So the latency stage, or stage 0, is when the transport capacity is reduced. So that means there's been an injury to the lymph system. Either you've had a lymph node removed, you've had radiation that has damaged some lymph vessels, and there is no visible swelling yet. So most likely, all of you here today, if you've had some sort of cancer treatment, are in stage 0 lymphedema, which just means that your lymph system has been impacted and you're at a higher risk of developing lymphedema. It doesn't mean that you have the swelling right now, but unfortunately, if you have had any surgery or injury to your lymph system, you are at an increased risk. But don't worry, because we're going to go over ways to help prevent you from getting it. Stage 1 would be pitting edema or swelling. Pitting edema is when you can push on your skin and it leaves an indentation. In stage 1, the swelling reduces with elevation. So if you lift your arm up over your head, or when you sleep at night, the swelling goes down. And there is no fibrosis or hardening yet. In stage 2, pitting becomes more difficult. So that hardening is beginning. The fibrosis, we call it, the tissues are getting hard. You're not able to push on the skin as much. And stage 3 is non-pitting with skin changes. So then you might see the discoloration, the papillomas. This is very advanced, and typically I don't really see patients that get this far. As long as you're aware of it, and getting this education today is great, you can definitely prevent it from getting this far. So you can see in the picture, that's an example of pitting edema, when you're able to push and leave that indentation. That is a sign that you have edema. If you're not sure, edema is just another word for swelling. So if you're not sure if you have any swelling, that's a sign that you do. Okay, so cellulitis, this is a common infection in individuals with lymphedema. Whether you have it or you're at risk of lymphedema, you're at higher risk of cellulitis. That's the infection I was talking about earlier. So just some signs and symptoms to look out for. The limb We'll have redness, like in this picture, in one area, pain, hot to the touch. You might develop a fever, and you might have more swelling in that area. And if you have this infection, you should go to your doctor right away. You just need a medication to reduce that. Okay. So this is probably most important to all of you. That was just a little background on lymphedema. But here are the practices that you can take today to reduce your risk of getting lymphedema. So I keep referring to the arm because the breast cancer is very common, but if you've had any kind of surgery to the groin area or to the leg, you might develop this in your leg. So any limb is possible. It could also just be the breast, just be the neck, just be the face, if you've had any sort of tongue or face or neck cancer. So these are all options, but I'm going to keep referring back to the arm just for this presentation. So number one, you want to keep the limb and the area clean, dry, and moisturized. You do want to be sure you dry it off thoroughly after you shower, because sometimes water stuck in skin crevices can cause skin breakdown. And all of these risk reduction practices, the goal is to reduce the injury to the skin, because any type of injury to the skin can cause it can cause swelling, which can progress to lymphedema. So for example, before I dive into this, just so that makes sense to you, let's say you twisted your ankle or you got some sort of injury, you'll see swelling to that area. That is the blood flowing to that area to try to cure it, to try to fix the injury or the cut, the burn, the injury. And that is a good thing that our body does. It sends the blood flow to help the area. However, if you have a limb that is at increased risk, so you've had breast cancer surgery, your arm is at increased risk. If you injure or cut that arm, your body might send blood to help heal that side, and it might cause some swelling. That swelling could be the amount that is enough to kind of put your body over the edge and trigger the lymphedema. Not always, so don't be concerned that, oh, I got a paper cut today, I'm going to get lymphedema. It's just in best practice to try to avoid as much as you can. And we'll go into questions afterward. So keeping the limb clean, dry, and moisturized to avoid skin breakdown of water. Dry skin can cause cracking, any type of cut to the skin. You want to wear sunscreen to avoid burning the skin, being careful with razors if you're shaving, being careful with clipping your nails too close and getting cut, and avoiding blood draws and injections on the affected side. And that most likely your doctor has told you you're probably getting blood drawn on the other side. So all of these things, just being careful. So don't go walking in a rose bush and getting all cut up on that arm. Try to wear a long sleeve or something, gloves, try to protect that arm or leg. You want to avoid constriction. So get your blood pressure reading on the unaffected side. Also, any kind of tourniqueting effect. So either an article of clothing that kind of cinches in at one point, or any jewelry that's too tight, a ring or a watch that's too tight, that can cause more swelling underneath of that. And then it's also good practice to wear a compression garment during heavy activity and when flying. And we'll go into that a little bit more. So what should you do? You should practice your risk reducing techniques. If lymphedema is suspected, if you see any of these signs, you can get a referral from your doctor to see a certified lymphedema therapist. And know that lymphedema can be treated. And the treatments consist of what's called manual lymph drainage. That's where we physically change the flow of the lymph fluid and we move the fluid to the unaffected sides. Compression bandaging, therapeutic exercise, and compression garments. And if you do go see a therapist, they will explain everything more in depth and help you with that. So, a little bit more about compression garments. Some popular brands are Juzo, Medi, Jopes. So you can find these on the internet. These are just, if you're looking on Amazon for a random compression garment, these are more trustworthy brands. Some brands do not provide as much compression as others. You should get fitted prior to sizing, for sizing, by a certified fitter. So they'll measure your limb and tell you what size you should get. But these compression garments can be sold at pharmacies. Lymphedemaproducts.com is a great website. If you want to take a look at that, they have all sorts of compression garments. Amazon, you can look up. And at Somerset Hospital, there is a wellness boutique. They have a fitter. So you can go there and get sized for the correct compression garment. Or you can always go to a therapist like myself, and I would help you get fitted for the right garment. The garments, when you wear them, they should fit without wrinkles. They should not cut off your blood circulation, meaning that you don't see any changing of colors in your fingers or toes, no numbness or tingling in your fingers or toes, no coldness in your fingers or toes. Those are just signs that it is too tight and cutting off your blood circulation. It also should not be loose. They definitely need to be properly fitted. That's why I would recommend, if you feel that you are at risk for this or experiencing these symptoms, to just go see someone certified in this, because they'll help you out. They'll make sure it fits correctly. They'll make sure you can get it on and off. Here are some examples just so you can see what they look like, depending on your condition or where your swelling is. A therapist or a fitter will help recommend the right garment for you. These are not all the options. There's many options. There's also many colors. You can get it in hot pink if you prefer that. Okay, so that is it for compression garments for now. So I'll go a little bit into exercise. So exercising can also help reduce your risk of lymphedema or reduce any current lymphedema that you have. So as your muscles contract, they actually help to pump the fluid throughout the body, the lymph fluid that we're talking about. So it works in conjunction with all of the other therapy. We do the massage, we do the bandaging, but the exercise is very important also, because that muscle pumping really helps to put the fluid that last bit. Weight management also can help with lymphedema prevention and management. So exercising to manage weight can also be helpful. A lot of people are not sure how to begin exercise after cancer treatment. Any type of light exercise is safe if it does not cause any pain or discomfort. So you just start slowly and build your way up. If you do need help with that, again, a therapist or a physical therapist can help you come up with a program, help you regain that practice. Here are some exercises common for arm lymphedema, but great for everybody. Squeezing a ball, getting the hand moving, shoulder shrugs or shoulder rolls, and just shoulder abduction means kind of like a jumping jack motion, bringing your arms up and down to the side. Exercises for leg lymphedema, bending your knees, ankle circles, marching. And again, these are not tailored to you specifically, it's just some examples. Exercises for head and neck lymphedema, head tilting, head turns, chin to chest. Some great exercise I always recommend is walking or swimming. Swimming is very good for the joints, very good for the body. If you just want to start off with simple walking, that's great too. Anything is better than nothing. And stretching is good too. Okay, so this is the clinic that I work at, New Brunswick Outpatient Therapy. We have 3 therapists certified in lymphedema therapy. We are open, we're not actually open Monday to Friday, 7 to 7. We close Wednesdays and Fridays at 5. But generally, I just like to make that known in case you're a working individual, you can get a 6 p.m. appointment. And this is our phone number if you're interested in therapy, if you want to jot down that phone number.